On August 14, 10:20 a.m., Anytown resident Ana Garcia was found dead in her home. The body was examined by a medical examiner, but the cause of death could not be determined, ultimately creating an investigation. Ana was previously seen by her neighbor the day before her death walking her dog. This same neighbor later called the police next morning as he heard Ana's dog barking. Police and EMTs arrived at the scene at 9:56 a.m. and determined Ana's death. Ana Garcia had multiple illnesses, such as type 1 diabetes, sickle cell disease, concentric left ventricular hypertrophy, which may have contributed to her untimely death.
Autopsy and medical reports. Ana Garcia had a medical history of sickle cell disease, type 1 diabetes, and left ventricular hypertrophy, which left her with a pacemaker. Ana had been diagnosed with all of these diseases at a young age, therefore treatments for all three diseases had been pursued. Ana had previously taken hydroxyurea for sickle cell disease, according to medical reports, and also had a pacemaker implanted for ventricular hypertrophy, and took insulin for diabetes. Ana Garcia also had attempted to follow a healthy diet to manage her diabetes, but according to her food diaries and autopsy report, Ana had ingested large amounts of sugar and fat the night before her death.
Ana Garcia had been diagnosed with type 1 diabetes as a teenager, which means her body did not produce enough insulin. Ana most likely took insulin injections to help manage her diabetes. Diabetes can lead to complications such as damage to the kidney, nerves, and vision. Ana attempted to eat a healthy diet, but as mentioned previously, consumed a lot of sugary and fatty foods on the night before her death.
Since Ana Garcia had sickle cell disease, her red blood cells were sickle-shaped. Because of this, it would have been easy for these sickled cells to clot the openings of blood vessels, not letting any or very little blood through. If a blood clot occurs, the body is deprived of nutrients such as oxygen, as blood cannot properly pass through. This can lead to complications such as strokes, or the kidney, heart, eye, and brain can be damaged as a result of restricted circulation.
Unlikely but possible cause of death is complications from a diabetic coma. Causes include diabetic hyperosmolar syndrome, where blood sugar levels in the body are extremely high, or diabetic ketoacidosis, where the body breaks down fat instead of sugar as glucose cannot enter the cell. Relation to symptoms include headache, thirst, blurry vision, high blood sugar levels, nausea, and vomiting. If a diabetic coma is left untreated, it can lead to death. It is unlikely that diabetic hyperosmolar syndrome or diabetic ketoacidosis could have caused Ana's death, as glucose levels above 300 are dangerously high for diabetics, but levels above 600 put a person at risk of falling into a diabetic coma. Ana's glucose levels were 280, high for diabetic but not high enough to put her in a coma. It is also unlikely that Ana died from ketoacidosis as it usually caused by missing injections or infection, but Ana had an injection site on her thigh when discovered in her home. Possible cause of death is sudden cardiac arrest. Causes include left ventricular hypertrophy, LVH, and atherosclerosis. Evidence of cause. LVH can lead to sudden cardiac arrest. Sudden cardiac arrest can also be caused by arrhythmias, which can be a result of high amounts of potassium, which Ana had, diabetes, or high amounts of sodium, which causes thirstiness. Atherosclerosis constricts blood vessels. Coronary artery disease is a complication of this, when the arteries are narrow and it causes a heart attack and failure of the heart. Relations to symptoms: mitral valve prolapse, lack of exercise and a healthy diet, nausea, vomiting.
Chronic kidney disease is the most likely contributor to the cause of death. Atherosclerosis is caused by insulin resistance from diabetes. High blood pressure, cholesterol, and triglycerides can cause the blood vessels that carry oxygen from the arteries to become thick and stiff. Anna has these signs of atherosclerosis that causes the arteries and blood vessels that are leading to the kidneys to be narrow, which is proven from her mild peripheral vascular disease in her left leg. Anna has sickle-shaped red blood cells that are more likely to clot, especially in these narrowed vessels. Also, Anna has a history of a heart disease that increases the risk of chronic kidney disease. Some symptoms Anna has shown are hyperphosphatemia, hyperkalemia, and hypernatremia. The high phosphate levels show that the kidney is not able to filter blood, which causes the excess phosphate waste to be let back into the body. This causes a disturbance in the balance of phosphate and calcium levels. Anna is shown to have lower calcium levels since phosphate levels are high, possibly because of the break in her leg that allows her bones to be weaker. Anna has high sodium levels that are caused from kidney problems. Also, she has high potassium levels due to this kidney disease as well as her type 1 diabetes. Not to mention, vomit was found beside her at the crime scene, which is a symptom from kidney failure. Anna also has swelling in her ankles and was severely anemic, which are caused from this disease. With the combination of Anna's lifestyle, type 1 diabetes, sickle cell disease, and left ventricular hypertrophy, chronic kidney disease is a result. With Anna's worsening condition, she could have developed irreversible damage to the kidneys, also known as end-stage kidney disease. The complications of this include pericarditis, or the inflammation of the sac-like membrane of the heart, which is possibly shown in Anna's x-rays of the heart. The chronic kidney disease eventually contributed to Anna's death because of her other illnesses. Since Anna became severely anemic due to this disease and sickle cell disease, and the fact that she had left ventricular hypertrophy, her heart must have been under a lot of stress, leading to cardiac arrest.